See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association and hosted by nurse economist and health tech specialist Shauna Butler.
I'm Shauna Butler, the host of See You Now, a podcast that shines a light on the nurses addressing today's most challenging healthcare problems, and never has that light been as important as it is right now. As the entire world learns about the coronavirus and responds to this massive disruption to our healthcare systems and teams, it has challenged nurses to rapidly rethink and redesign our existing care delivery practices. Over the next few weeks, See You Now is bringing you stories from the nurses in the midst of the coronavirus pandemic who are finding new and novel ways in real time to care for all of us. From health bots to artificial intelligence and everything in between, we're increasingly relying on and deploying technology to meet our collective healthcare needs. COVID-19 is changing the ways we work and interact. It's also accelerating the pace of transformation within our healthcare systems, how we use and share data, work as teams, and communicate with patients and communities. In this episode of The Nurse Response, we talk with Molly McCarthy, the Chief Nursing Officer at Microsoft, about how this global pandemic is fast-forwarding the future of healthcare to the now of healthcare, and the lead role nurses are playing in this rapid transition.
COVID-19 coronavirus has accelerated the adoption of technology and, quite frankly, put a huge microscope on all of the gaps in our healthcare system in the U.S. I'm Molly McCarthy. I've been a nurse for 26 years, as well as a technologist. Some might refer to me as a health geek. But at Microsoft right now, I'm the National Director of the provider industry, as well as the Chief Nursing Officer. One of the things that I've noticed over the past 7 weeks is just the rate of transformation that's taking place, the rapid adoption of technology, whether it's a health bot, whether it's virtual rounding, whether it's a televisit, whether it's involving the patient and family in a virtual huddle, for example. These technologies that have been out in the marketplace, just the adoption in the past 7 weeks has been truly amazing, and more than I've seen in the past 7 years that I've been at Microsoft. One example that we've seen is the healthcare bot. The healthcare bot service is just one solution that uses artificial intelligence, for example, in this case, to help the CDC and other frontline organizations respond to the multiple inquiries that might come in through triage lines, through call centers. And this is really enabling the bottleneck to be reduced and frees up our doctors, our nurses, administrators, and other healthcare professionals to provide critical care to those who need it. When we rolled this out in 2019, it was very well received, but at that time, when you're a hospital or a healthcare system looking at all the different technologies that you might have to have versus a nice to have, I don't think this at first glance was one that people felt they had to have. Whereas since COVID-19, we've deployed over 1,200 health bots across the globe, not just in the United States, but across the globe. We've had 18 million users, and there have been over 160 million messages. So within the past, 6 to 8 weeks, truly game-changing technology in the lives of the patients as well as within the systems. Innovation in nurses seems to be a new thing, but for me, it's not. People talk about the future of nursing in 2030. The future of nursing is happening now through the transformation we've seen in the past 7 weeks. Nurses are on the front lines, they are in leadership roles, and they truly are leaders responding to one of the worst pandemics in history. While it's tremendous difficulty and not an easy road. The opportunity that nurses have now in front of us because of our leadership with coronavirus, but then also in technology, shines a new light on us. And I'm hoping that many people across the U.S. as well as the rest of the world looks at this profession and actually says, yes, I want to be a part of that. I want to take care of people. I want to look for the best in them and really bring that out. So we know that the challenge across the U.S. and really the world has been personal protective equipment, and scares me to think that my colleagues are out there going to work without a mask. And what scares me even more is people telling them not to speak up about it. That to me, I don't comprehend at all. We need to take care of our frontline workers, or we're not going to have the workforce to support patients throughout this pandemic, but then beyond. And so we at Microsoft have been working on a new collaboration with the American Hospital Association based upon its 100 million mask challenge, which was calling on manufacturers, the business community, and individuals across the country to coordinate efforts for PPE. Essentially, we are taking this effort that they started even further. And so AHA, they are working with Kaiser, with Kearney, with Merit Solutions, with Goodwill, UPS, and with Microsoft to launch Protecting People Everywhere. And this is an initiative that will start out with the Health Equip app, which is an application that will allow individuals to go on and input donations for PPE, for example, medical grade masks, gowns, etc. And organizations can go in and actually input what their needs are. So it's all going to be based on needs criteria. We'll also track the PPE donations and manage shipping through UPS to the specified hospital. So we're really excited to be part of this philanthropic effort. This isn't necessarily part of my day job, but this was an effort that I felt strongly about based upon seeing the news, understanding where the breakdowns in the system are. So anything that I can do to contribute to this effort is very important to me. With COVID-19, it's just really elevated and escalated what we can do together to meet the needs of our customers, of our patients, of our families.
Coming together as a massive, open, online community can help our health systems and the people who power them learn from and make sense of what's happening. Each day, we're learning about how communities, associations, public and private enterprises stretched across the globe are cooperating and collaborating in response to the coronavirus challenge. Perhaps it takes a pandemic to accelerate change, adopt new tools, forge partnerships, and let go of ideas that served us well in prior eras. As we all learn together, we build relationships and create networks that truly help us integrate health into the rest of our society. Speaking of networks, we're grateful to have you as part of ours, and we want to hear your stories, insights, perspectives. Email us anytime at hello@seeyounowpodcast.com. And as much as we love new technology, we're also fans of the tried and true measures to stay safe and healthy. Wash your hands, avoid the germ zone of your face, and be kind. For See You Now, I'm Shauna Butler. Thanks for listening.
Johnson & Johnson is proud to power up nurse-led innovation that is transforming health outcomes through skill building, leadership development, and more. The American Nurses Association ignites and celebrates nurse-led innovation to redefine quality nursing and advance healthcare for all. Johnson & Johnson and the American Nurses Foundation are excited to launch the Coronavirus Response Fund for Nurses. Go to the American Nurses Foundation website to learn more, share, or donate. And thanks.